Hello. This presentation is for those medical students starting their clinical rotations and for the first year residents starting their internships. My objectives with this presentation is to make the transition from academic to clinical work the least painful possible and to reduce unnecessary suffering, like the one experienced by many like you in the past. Consequences such as suicide, depression, divorce, substance abuse, and bitterness are not an uncommon source of personal tragedy. The profession also suffers from incompetence, carelessness, and cynicism. Indirectly, also, the profession suffers when you deny the world your full potential. The problem. Up to this point, you've been asked to learn the past and memorize explicit knowledge. This is factual knowledge devoid of value, is neither good nor bad, not apt for interpretation. You've been studying to think like a scientist, to objectively describe the world. However, from now on, you'll be learning a trade. You'll be expected to accept problems, use skills, and produce results. You'll be asked to act as an engineer, to use the tools of the present, to apply the wisdom of those who you admire, those who act properly in the present. Luckily, the path in mastering a trade is something that has been described mythically. You will be required to acquire new skills and knowledge to function in a new environment with new individuals with their own culture, to become an expert, and eventually generate new knowledge and renovate what is old. You've done this before. You've learned to play sports, to use a computer, to fall in love, to drive and cook, and play any musical instruments. Recall you did not memorize the manual, that you tried and failed, that you tinkered around the edges and with the essentials, and that mastery of it only came with time and practice. So what are the tools that will aid you in your quest for results and skills? You'll need knowledge of that which is present practice. However, this is not perfectly abstracted knowledge. Sometimes it's not even the result of the scientific method, and sometimes it's not even something that can be articulated or abstracted by yourself or your mentors. Also, during your career, some of it will be proven wrong. Like leeches and phlebotomy were useful for our ancestor, they are also wrong when we look back. So, how do we know what is truth and useful in this uncertainty? The things that we know, the things that we do and practice is knowledge passed down to us from our ancestors. It has survived because it works. This knowledge is imperfect. It is the best bet at the time and place and knowledge base, only mistaken when compared to the future. In the days before, congestive heart failure's pathophysiology was understood, rotating tourniquets relieved patients' symptoms. Now in the days of diuretics, this is unnecessary. However, it was the best bet back then. You see, what you are being given is a map of a minefield. In a perfect world, you will know exactly where these mines are and the means to find them. But mostly what you will get is a story of a man who once went through this minefield and performed a series of rituals, a narrative of where he walked, what he did, who he prayed to. A conservative person, in order to avoid stepping on a mine, will repeat every action of this traveler. A more liberal person may take some risks, but all will be imitating the traveler in the story. Of course, all paradigms, rituals, and traditions are built on unprovable beliefs. Knowledge has a half-life. The things that worked are the basis for our present structure. The scientific method is designed to question those bases. New paradigms will have to explain the past, present, and predict the future. The area of knowledge which is not constructed on paradigms, that round of pure logic, is math. A equals A. It's universal and does not require proof. Sadly, most of the knowledge that you will be using in clinical practice is not derived from math. The problem is not unique to clinical medicine. Human affairs, politics, economics, and religion have all faced the same question. What should sit up top? That which is reasonable, or that which can be deducted from observation? That which is logic, or that which is founded in tradition and results? What should guide behavior? Olympian man who understands philosophical principles and acts accordingly, or the man who respects tradition and holds things old sacred? In philosophy and theology, this is reflected in this painting by Raphael called The School of Athens. On one side, you have those who hold logic and reason at top, flanking Plato, and those who favor practical knowledge and deduction from reality, flanking Aristotle. Now you are facing a new unknown. It's a new world, something that is filled with strange people doing strange things, and you only have a few tools of discrimination about what's in front of you. How do you transform this unknown world into something familiar, where things are tools or are irrelevant, where unknown and dangerous things still happen, but you are surrounded by a world full of valuable things? Well, first of all, you have to establish some goals. A way of doing this is to ask yourself, what is the most difficult thing I can do with clinical work to serve the highest goal in medicine and to serve the highest goal in life? This way, what you do in life doesn't have to change in your practice now or in the future, nor has to change in whatever hospital you go to. Be careful what you choose. Whatever is your goal is, you will be entering a covenant with it. Sacrifice time and effort to it, and have faith that you'll become the one thing that you're aiming at, and that it's worth the sacrifice. In other words, that is meaningful. So whatever you put in front of you, that which you admire, but is also that which will judge you when you steer off the path. It's only through faith that we can commit voluntarily. A goal beyond ourselves, filled with meaning, is the antidote to the temptation of not continuously improving. This concept is represented by the stairway to heaven, in which the goal is somewhat undefined and low resolution, sitting in the horizon. The people that you admire are further along that path. However, the next steps are clearer. Since you have to transform yourself into that which possesses the knowledge and skills and that holds the identity of a competent clinician, you must be initiated into this world. Luckily, there's a mythical way of achieving this goal. Pain is always the signal that shows you the places for improvement. It is the feedback signal to which you must pay attention and accept its cruel judgment. This integration, recognition that your presuppositions have failed, means killing that part of you that thinks it's right about a subject. Peregrination, a process by which knowledge is generated. It's a period of doubt, trial, and error. It's a call to adventure. Conjunction is that integration of the new knowledge. It's consuming the mythical fruit that changes you. It is the birth of the person you wanted to be. In alchemy, the philosopher's stones is the process by which matter is transformed into precious metals. Matter that is filled with meaning. Matter is matter that matters. There's plenty of advantages that can come with new pain. Skin in the game is one of the ways how systems survive in evolution. It is the only true test of knowledge because survival is the only reality that matters. Pain shows you that reality, beyond reason, experimentation, faith, or prediction. Mathemata, pathemata, or learning through pain, is the recognition that a negative outcome is more useful because it has no more downside. You already know what not to do. You see, a positive outcome carries with it the possibility of future mistakes. With enough error, the system or base of knowledge becomes simpler by elimination. It's also part of the initiation, gives you war stories, helps you calibrate your anxiety mechanisms, to put things in perspectives, to give you a glimpse into what a horrible situation could be. Gives you something to share with your future colleagues and gives them the knowledge that you are tough, useful, and that you can be trusted. Unfortunately, we're not always paying attention, and we might miss the useful information that pain brings. When bad things happen, for no good reason you'll feel like you don't belong, like an imposter. A good thing to remember is that it's all part of the process. We can always look beyond, keep our goals in mind, and trust, have faith in the judge and the redeemer that you have chosen. After all, the best stories are those in which the hero is bloodied and in true danger, but he manages to survive. Sacrifice is necessary. You see, you are probably wrong about something, or you have a skill that needs to be improved. The part of your brain that presupposes that you know must be undermined, must be killed. Those neurons must be unplugged, those neurons that are connected in a way that yields pain. You'll have to separate positive feelings of knowing from false actions that result in pain. Your brain will resist, because being right feels good. However, being right doesn't make you smarter. Feeling stupid makes you smarter. Being confronted by a cognitive dissonance can produce a visceral reaction like a tantrum. Faith in that which lies beyond promises that the bigger the sacrifice, the bigger the reward. This assumption of faith is reflected in narrative as a sacrifice of that which you hold dearest, like a son. The dark side of sacrifice is the evidence that accumulated rejected sacrifice advances, that the world, God, the judge, your colleagues, even destiny is against you. For who among us has not had its efforts foiled and rejected repeatedly? Conscientiousness, always giving your best shot, offers protection against poorly conceptualized and executed sacrifices. While being diligent, a rejected sacrifice is more valuable because it leaves you with no doubt that you are in the wrong place. Maybe a change of goals might be in order. However, being diligent, self-control is expensive. It fatigues. Sleep, well-being, good nutrition helps. However, if you choose to be mediocre, or you are just too tired to give it your best, a rejected sacrifice can lead you to bitterness. The most famous story of rejected sacrifice is also the oldest. It might be arbitrary, but a rejected sacrifice, at ignoring the information that it brings, can lead to the darkest of places. Once you've cleared off the brush, burn the dead wood, you'll have to look for the new knowledge, that which lies in the unknown. The unknown always causes fear, surprise, anxiety, and curiosity. The new and the unexplored can look more threatening than it really is. The bias of fathomability, it's better to deal with the devil you know, and you exaggerate the risks of a novel threat even if the devil you know is objectively more dangerous. The bias of dread is when the worst case scenario takes front and center in your mind, when those rare events become vivid. To overcome these obstacles, a hero must be called. Knowledge that lies in the unknown has to be generated and renewed as a consequence of constant voluntary exploratory behavior. The more risks you take, the more chances of failing. Like Prometheus, who paid with eternal damnation the new knowledge of fire that he shared with humanity. The less risk you take, the least chances of learning. Because to take arms against the sea of troubles and by opposing end them to die, to take risks, to take enough risks means to die. Thus conscience does make cowards of us all. The more you explore, the more you'll bring back to venture the next time. The useful person that you admire or envy partly embodies this ideal. In the myth of King Arthur, the knights looking for the Holy Grail have to go to the darkest place of the forest, to be humble like an idiot, and to recognize loudly ignorance might be a virtue. There are things that will stop you from accepting those gifts from the unknown. Fear and pride dictate that the new is too much, that it's better to leave things past and present and examine. Epistemic arrogance is the thing that shuts off exploratory behavior. It's the thing that makes you perpetually convinced that you don't need new knowledge. It jeopardizes future expansions of knowledge. It's pride that makes you see that you must change the world, not your way. Is that what makes you reject reality for too long until reality comes crashing down? As when Pandora opened her box. It's also a temptation to trust the existing categories, to place the unknown, the new, where it doesn't belong, but is comfortable. There is a comfort in being the victim. It frees you from having to make sacrifices, to take risks. It is nobler in the mind to suffer the slings and arrows of destiny. However, your destiny will not change by just feeling sorry for your situation or by accepting it without complaint. Frustration is the place you find yourself when things don't go your way repeatedly. Loss of faith in a better future. When you stop caring, maybe do some harm. They all have the same effect, separating consequence from behavior. Do this enough and you will always be in the unknown, where things never go your way, where everything is a threat, where fight or flight is always in the menu. This place can cause physical harm, since enough cortisol can kill you. Cortisol will change your mind, burnout, and hopelessness. In the unknown, when you cannot trust the information advanced by experience, you put the tools to confront chaos in jeopardy, and you can always rely either on reason, by rejecting pragmatism, or by relying on dogma and rejecting novelty. The great philosopher Dave Chappelle shows us what happens when we refuse to change ourselves and force the world to change. Othello had it all: a beautiful wife, faithful friends, a kingdom, and a life rich in adventure. However, the devil himself convinced him that he is no hero, that he is a victim, and all he can do is to take revenge. Revenge is the only path left when we forego our quest towards the transcendent. If you complete your initiation, there will be a new you. In medicine, you will lose your first name, and you will be referred to as doctor. You will stop ceasing to be this useless, frightened being lost in the forest. You will be predictable. You will be an individual rooted in common wisdom. You will be valuable because you know how to fall and take punches. You will be in the known. You can classify things. You can classify people into friendly or foes, but mostly into irrelevancy, because most things are useless. If you were in a tribe, you will gain a mark. However, your life will still be rich with symbols that communicate your new status. How to survive this process? Well, know yourself. How do you react to the unknown? What are the limits of your knowledge and ability? Where does confidence fade? The more you explore, the more you'll be comfortable exploring in the future. Why is residency so stressful? Residency is an epoch. It's the time when you transform the landscape of the specialty, the operating room, the outpatient clinic, the patient floor, into something you know, integrated into your being, where you make it home, whenever you are at the hospital, and you know what to do. There is a logic of how things are done, and there must be a concordance between you and the environment. Once you master it, you change the perception from terrifying to useful. This new world is also filled with new people. One of the problems with experts is that advice is cheap. Most of the time is useless if not contradictory. It doesn't really address the problem that you are having, or its diagnosis and therapy are incorrect. The problem with advice is that it's designed to help only the person giving it. A solution is to consider any interpretation invalid that does not win the assent of the patient or trainee, and we must search until we find a formulation that does. Another solution is to look at the actions, not the words. We all do more than we can describe, and what your teachers do to solve their problems, it's more important than whatever rationalization they give to themselves and to you. If you ever played racquetball with someone more experienced, you'll recall climbing the walls and doing backflips, sweating profusely, while your more elder and experienced partner has barely moved. What may look frightening and even panic-inducing may not be filled with terror for your teacher. That which you consider to be very relevant may not have any value to your teacher. Don't take it personally. It's all part of the learning process. Most things are irrelevant, and you'll be wrong most of the times. The no will come first. If you recall from behavioral medicine, memory can be classified into that which can be perfectly abstracted or semantic, that which can be narrated but not the product of reason or scientific deduction, and finally that which can all be demonstrated by action. A more comprehensive map of the areas of knowledge in which you'll dwell go from creative exploration or trial and error all the way to the perfect extraction of first principles, or a philosophy. Scientific knowledge is that whose subjective experience is common to us all. The proof is universal or unambiguous. There is very little room for interpretation, so there is very little room for controversy, especially one that involves questions of morality. This type of knowledge is the subject of the written boards, where there's only one right answer, so there's no need for experience, just knowledge. The problems that can be solved with this type of knowledge are those where all causes and effects are known at the same level of analysis. Problems that can be fully abstracted. Actions and simulations are predictable and reproducible, and errors can be inferred by data analysis alone. In science, subjects like gravity, pharmacokinetics, anatomy, physiology, pharmacology, transmitting this knowledge is easy, is written, proven, and devoid of controversy. However, the cost of production is high. The scientific method and scientific thinking requires effort. We prefer to draw from experiences, narratives, and deductions. Falsifying our conclusions, skepticism requires effort. Narrative knowledge tells us what things are for, not what they are. The experience of this knowledge is individual. The proof comes from tradition and survival. The elders that have practiced for years using myths and tradition have a wealth of knowledge that could be interpreted as the art of medicine. These are things that can be acted out but not rationalized or verbalized to every detail, so some elements of causality or correlation are known. Simulations are inaccurate and only reproducible sometimes. By its nature, lack of universally acceptable verification process, it is the source of passionate conflict. There is a socially mediated verification process. However, the danger is systemic bias. Essentially, everyone gets it wrong at the same time. It is better to leave some room for reality-mediated verification. It improves insight, especially in times of confusion. It is better to depend on that which has survived the test of time. In this type of problems, right and wrong meet in a wide area of consensus. There's more than one solution. In the oral boards, the justification is as or more important than the answer, since incomplete solutions can be both true and contradictory at the same time. The type of problems that can only be partially abstracted can only be solved by narrative knowledge and non-scientific systems of analysis, like tradition or rules of thumb. Transmitting this knowledge is expensive, depends on the instructor's ability, experience, confidence, and its relationship to you. Even your teachers know more than what they can verbalize. Because we cannot separate value from perception, it's difficult to describe a world devoid of meaning, an objective world. This knowledge is locked behind the ability to communicate it. For some, anecdote, pseudoscientific explanations come easy, but for some, only the action is the only expression. of it. Those who are self-conscious create devices to avoid vulnerability. Things like rules of thumb are an adequate abstraction, like a story of a man who once went through the same minefield that you have to go through. Also, there are things that you just do, things that you cannot describe, things that you don't know you know or why. Things like learning not to touch the hot stove, how to deal with a patient victim of police brutality refusing medical treatment, things like recognizing and comforting the suffering of a dying child. This is the product of evolutionary or crowdsourced processes. It is the thing of procedural skills and rituals. It is the thing that a child does when he acts morally without being Shakespeare or a philosopher. Because of its nature, it can only be acted out. Your articulated beliefs and reasoning separate concept from action. You cannot reason your way into a solution. In fact, it might even be counterproductive. Besides the explicit transmission of knowledge through formal scientific literature or narrative, there's also imitation and mentorship. It is how we learn our more basic skills. We unconsciously embody the action of those who we admire and relate to. With enough practice, we integrate those behaviors into our own being. It becomes unconscious and automatic. These behaviors are the practices of the dead, which came about for reasons lost. It is the distilled knowledge of tradition, and some of it sits outside consciousness. The value of the past is ambivalent. It could be wrong, unpractical, and ungrounded. Just like in morality, you can practice and perfect the worst human can offer, and even become a master at it. So too we can imitate the worst of the past without question it. However, it could be right, worthy of respect and veneration. Everything that we know, we owe it to those before us. Because you'll depend on others for the transmission of this non-scientific knowledge, you want to be dependable, likable, relatable. Knowing how to play the game matters. Every now and then someone exceptional violates the established conventions of behavior and gets away with it. Whether it is a Sherlock Holmes or a Dr. House, these exceptional people do exist, but most probably you are not it. You'll have to play the game. Most probably you are not the smartest guy in the universe. Finally, the last category of knowledge is no knowledge at all, the unknown, the completely novel, things previously thought as irrelevant. When things don't work as expected, the reaction is always the same. Fear followed by surprise, followed by anxiety, followed by curiosity. Even the unknown can be divided according to its predictability. The known unknown are those problems that, although not self-evident, it is possible to predict its existence, although not their precise manifestation and magnitude. All new systems have defects, and all good engineers plan for them. It's only when you let time and experience work that their presence and extent will reveal. The unknown unknowns are those problems that are impossible to predict and make contingencies for. So sufficient experience is not enough. It's only when they grow too big to ignore that they become self-evident. In this schematic representation, we can see the different types of knowledge and its characteristics, but also the processes that take us from the unknown, like experience, into that which can be acted out. Those who represent patterns of behavior, sometimes as art or narrative, take us to myths and dogmas. And finally, the scientific process that take those observations, make them explicit and falsifiable. It takes a special kind of person, a pioneer, someone who's not afraid to venture into the unknown, do things out of curiosity, necessity, and bring incomplete but valuable knowledge. We see them represented as the absent-minded professor, he who's crazy enough to take irrational risks. The artist sees things that most of us can't, draws inspiration from the undescribable, guided by their intuition. They know it's important, they just don't know why. They have an uncontrollable desire to represent it, for us to appreciate it. They make it aesthetically pleasing, even beautiful. Michelangelo saw the divinity of the individual by depicting divine images with recognizable faces. He did this before any philosopher or politician. Santiago Ramon y Cajal, an artist, explorer, soldier, and histopathological doctor, combined exceptional artistic ability with innovating technology to map never-before-seen structures. In our world, we see it in case reports, series, opinions, and editorials. The scientist uses the scientific process to transform mythical knowledge into fully abstracted knowledge. Sadly, intellectual productions follows the permanent distribution of all humanly produced goods, known as the Pareto distribution, the Matthew principle, or the 80-20 rule. This means that 80% of the research is produced by 20% of the researchers, and 20% of those highly productive researchers are exponentially more productive since they produce 80% of the 80% of the intellectual production. This distribution was described by an Italian economist that saw it within the land ownership in Italy. It applies to many other areas of human endeavor, like book sales, prisoner abuse by vicious guards, and casualties of war. Although everybody hates residency, everyone remembers it fondly. During this time, you'll go from being surrounded by the unknown, with danger always lurking on the bottom, to being in a dangerous, stressful situation, but with all the weapons and trainings for you to be the hero. When do you need an expert? When there's a crisis, a problem that needs to be solved. In other areas like policing, experts are faster, and even though they cannot explain why they are more effective at detecting and neutralizing danger. In the poultry industry, greatly benefited from the emergence of these experts. It is because of them that chicken is cheap and plentiful. A common pattern is that experts are faster because experts use their memories. Experts use vast amount of knowledge, pattern-based retrieval, and planning mechanisms acquired over many years of experience in the associated domain. Experts don't think, they just use their memory. They recognize patterns and they apply reliable solutions. Deep reasoning about cause and effect is only safe for when standard procedures are inapplicable or unsuccessful. When you have a partially abstracted problem, it's beneficial to have someone with experience and survival. Because we depend on memory, how do we make it available? Classically, in the days before widely available books and electronic reference, memorizing large quantities of material was required. Memory tricks were part of a good education. Even the way texts were written was in part as memory aid: poetry, rhyme, emotionally charged texts. In modern times, the experience of the day, that which is destined to become semantic or narrative, probably has to be dreamt first. Since speed and quality of recall is better after post-learning sleep, it is thought that spontaneous offline activity is critical for memory formation. Dreams might be simulation of what happened. They might not be a faithful representation, but an effort to extract meaning from cumulative experiences. Forgetting what's deemed irrelevant and taking new contextual information from the right hemisphere in small quantities so the creative doesn't overrun the categories in the left hemisphere to which it has to fit. Although our dreams are not veridical, they do carry with it meaning of what we consider is important and worth remembering. Because we want to advance the science and the art of medicine for posterity, there's also a way of transcending that which is current. How we gain the skills of social life, we also gain the skills useful in clinical work. We also start imitating the rules with infinite curiosity. Then we embody these rules even though we don't understand them. We are able to play games. Because of this, we act as one of the group. We adopt the identity of that we wish to become. Once we become that which we aim at, we can enforce the rules. It is the next step, that of the sage, he who can transcend what is known and hopefully improve the game for everybody else. It is not ideal to remain just an expert. An expert doesn't think. It is the sage that regains thinking and the infinite curiosity of the young. Thinking is to be an expert in opposing perspectives. It is to be two people at the same time. It is only someone sitting at the top that can balance respecting the present foundations without imposing tyranny and destroying the useless and outdated without descending into chaos. This balancing of opposing forces is reflected in this ancient symbol. Some stories come to mind on your quest to generate new knowledge and renovate practice. St. George and the Dragon is to confront problems head-on and to bring solutions out of this confrontation. There are problems all around you. There are your problems. You might not be able to solve them all, but the more you do, the better you will get. If you look for them, you might find them where nobody else is looking, possibly a strange and frightening place. What shall I do with a fallen soul? Offer a genuine and cautious hand, but do not join it in the mire. Once you detect the problem, give it a name. You have to formulate the question so your mind can frame it and work on the answer. Your mind will see what it's aiming at. Nobody can be a master of all. Be careful what you aim at. It determines how you see the world. Once you start exploring the edges of the known, luck becomes your traveling partner. That which grabs your attention carries with it the possibility of great opportunity. However, the errors that you get exposed to might be very consequential. So tinkering, trial and error, should not carry with it the possibility of your demise. New knowledge can be something unpredictable, very consequential and obvious in retrospective, or it can be an emergent property. Using grand schemes like Platonic concepts are useful, but potentially very dangerous because they blind you by summarizing the world, opening you to the unpredictable. Look around you for opportunities, situations where you can become useful or indispensable. See how being an excellent communicator is a valued skill. Improving everyday problems might become a revolution across all healthcare. Learning how to be indispensable, independent, and proficient by learning all technical aspects of your surroundings. Even tackling seemingly insolvable problems like bringing comfort to patient in undescribable and incurable pain. You'll be dealing with the unknown beyond residency. The idea is to be a rock during a crisis, to be the dependable, and to welcome the strange from a place of strength. The meek, or he who has the weapons and the means but chooses not to use them, it's someone that is willing to confront authority, to shamelessly ask stupid questions, to try new stupid useless things, to express fears and doubts and ignorance despite the ridicule and shame. It offers a protection against those shared lies and conspiracies of silence. Thymus is neither anger nor passion. It is the righteous impulse to straighten the world. It is a better ally to reason than the appetites and passions. It brings forth the good side of competitiveness and assertiveness. And learning how to be a warrior in a garden prevents you from the liabilities of this impulse. Becoming a tyrant, cheating, or winning unfairly, things that are detrimental to your colleagues or practice, will be detrimental to yourself. People don't forget, and the world is not that big. Non-naive courage is to extend your hand and trust and invoke the best of the stranger. To always tell the truth despite your ignorance and insufficiencies and the embarrassing situations is to have faith in the transcendent covenant. To try something new is the willingness to be a fool. Most probably you will fail. You are in a ridiculous and shameful way. Knowing that is freeing. You just need to know that you are fallible and that everyone makes a fool of themselves when trying something new. Courage is not the same as confidence. To try and be willing to fail is not the same as trying because you can't fail. Hospitality is to haste from the other a sense of intimacy. I found that the most miraculous phrase in a hospital is, "I need help." However, when asking for help from a place of naivety, desperation, or cowardice will bring in yourself false optimism, when you don't recognize your capacity to hurt, to be vengeful and resentful, or hubris, which can kill or hurt people, or when you simply act stupidly. People are mean and they will bite you. They will show no mercy if you ask for help from a self-conscious state. It will bring in yourself optimism, not a rosy-colored version of reality, but you know what to expect and still be willing to take risks with your eyes open. You are inviting the best part of the other. Also humblessness. Just saying I don't know or I need help after an honest effort will recruit forces from all over to serve you. Under this condition, what shall I do with the stranger? Invite him into my house and treat him like a brother so that he may become one. In pop culture, two contrasting examples of a person that despite its intelligence did not recognize malice in itself and only welcomed the world with hostility, and because of this he became a monster. On the other hand, we have a character not very bright, but someone who faces the world with eyes wide open despite its risks and hostility. Finally, a timeless story of he who goes into the world with the wisdom of his father, represented by a coat of many colors. During and after residency, everywhere you go, you will face the tyranny of the present structure. You are learning the past, and the present is always corrupt, decaying, imperfect, and all young people are always dissatisfied with the present state of affairs. Bureaucracy, paperwork, political intrigue are unavoidable. Rather than lamenting it, its presence, you can become the thing that knows how to handle it. You will also face the rapacious indifference of nature. It is always the innocent and most vulnerable that suffer the most. Unfairness is the rule, not the exception. The Red Queen says, off with her head. Now here you see, it takes all the running you can do to keep in the same place. Residency is a race. You can't stop. Your colleagues won't. Nature doesn't forgive. You cannot take the day off. You can't escape the deceitfulness of man. You will be working in a political environment filled with gossip and intrigue. Some relationships will be communal, long-lasting, emotional, but more valuable. There will be simple exchanges, business-like expedience, but based on perceptions of fairness and cordiality. How to play simultaneous games with several, sometimes conflicting objectives. You have to follow a set of rules in which you don't sacrifice your team, the future, your teammates, or yourself. All these challenges are unescapable. There is no point in being frustrated or to take it personally. On the contrary, you must be grateful. You've been granted knowledge and time-tested tools and the opportunity for adventure. These themes appear in popular culture. They are universally relatable, like the dim-witted boss, the rapacious nature of nature, the fact that it's always the innocent who suffer the most. It is always the present structure that is all arbitrary, tyrannical, and represented by the old and decaying king or the ice evil queen. Thank you for your attention.